Good afternoon, everybody. My name is Mike Willett at the Intertribal Council of Michigan's National Native Network. Welcome to the National Native Network webinar series on cancer risk reduction in Indian country. This webinar is titled Gambling with Our Health. This technical assistance webinar is hosted by the National Native Network, which offers technical assistance and resources for commercial tobacco prevention and control throughout Indian country. Your presenter today is Isaiah Brokenleg, MPH, epidemiologist and program director with the Great Lakes Intertribal Council. Isaiah is an enrolled member of the Rosebud Sioux Tribe and grew up in South Dakota, but now calls the Northwoods home. From a cultural perspective, he believes we are all related, and as such, we are all called to be good relatives to one another. As a Winkte, Isaiah believes that he is called to be a healer to move communities in the direction of positive change. From an academic perspective, Isaiah is a Bachelor of Arts from the University of Minnesota Morris with majors in Multicultural Studies as well as Applied Social Justice and Human Rights. He has a Master's of Public Health degree from the University of Minnesota School of Public Health. Aside from being a self-professed diva, aspiring stand-up comic, and chaplain, Isaiah is an epidemiologist and a program director for the Comprehensive Approach to Good Health and Wellness in Indian Country CDC grants. Isaiah is passionate about achieving parity in health, social justice, and working to end structural oppression and violence that hurts us all. No commercial interest support was used to fund this activity. By the end of this webinar, all attendees will know what theoretical win is. Attendees will be able to articulate the age and preferences for a smoke-free environment, and attendees will be able to tell 3 differences between commercial tobacco and traditional tobacco. Please type any questions that you may have into the question box into the lower right-hand side of your screen. Questions will be answered during the last few minutes of the webinar. And now at this time, I would like to throw it to Isaiah Brokenleg.
Hello, and thank you everyone for being on this. It's great to be here. My name is Isaiah, and if you look at the logo on the left, I work kind of where the eagle's beak is in Wisconsin, but we serve the tribes in Minnesota, Wisconsin, and Michigan in the urban Indian areas of Minneapolis, Chicago, Detroit, and Milwaukee. There we go. So in Indian country, almost everything in creation is a medicine for something. And if you ask a Lakota, they'll tell you water's the first medicine. And if you ask an Ojibwe, they'll tell you tobacco's the first medicine. And since I'm Lakota, I get to put water first. In general, tobacco and sweetgrass are used to sort of bring about good things, and sage and cedar are sort of used to get rid of bad things. It's sort of a gross overgeneralization about it. And then the inner bark of the red willow tree we call chanshansha, that is often mixed with any of those medicines. So I'm just taking a moment so you can see them all. So traditional tobacco traditionally has been a spiritual commodity, and when you ask somebody to pray for you, or you take something from the earth, or anything like that, you offer tobacco to someone else, or you offer it to the earth. And it's also used as a spiritual medicine. Some folks use it for physical purposes, such as in the garden and things, and also it carries the prayers to the Creator. Some people actually believe that the smoke itself is the breath of the Creator. Traditional tobacco, Nicotiana rustica, is a different plant than commercial tobacco. It gets to be probably about as tall as the desks that you're maybe sitting at, let's say maybe like 2 to 3 feet off the ground. and a leaf is probably about as big as your hand. And each tribal community will have a story about how it came to them. And some tribes will use this type of tobacco, and other tribes use just the red willow bark. Traditional tobacco has a yellow flower. So how is it used ceremonially? There's many different ways. These are some common ones. And of course, things vary from tribe to tribe. So in naming ceremonies or transition of any kind of life transition, like funerals or weddings or births, healing, hunting or gathering. Anytime you're asking for wisdom from someone else, you often offer them tobacco or bring it to them. Sometimes it's given also to like drummers at the powwow or dancers, and of course for prayer. So that is how traditional tobacco was used a long time ago. And because of some different things, it sort of changed the functional meaning, and also the type of tobacco used is changed. So I wanted to talk about historical or generational trauma, because I think that's part of the reason why we have such a high burden of commercial tobacco use today. So in a healthy society, you have one generation who passes on what I like to think of as their cultural DNA to the next generation, who then pass it on to the next generation. And so even though that first generation is gone, all of the consecutive generations or the following generations still have those same important messages. Think about some of the things you may have gotten from your parents or grandparents or aunties or uncles. Things like maybe which football team you root for if you have a football team. I'm from Wisconsin, so with the Packers, right? But I didn't do football when I was younger. Or what constitutes a Thanksgiving dinner might be another example. But really it's in reference to more deeper things, like how do you express love for one another, or how would you, for example, handle conflict within your family or community or culture. With historical or generational trauma, something interrupts that DNA transmission. And this is true for many different cultures. You could think of slavery or the Holocaust. In our case, it was boarding schools and government policies. This picture here is from the Lac du Flambeau boarding school, and if you look, really, there's no kids who are smiling except for maybe one or two in the middle there. This was a very difficult time for many people, and it really erased that cultural DNA that gets transmitted. And so that's really what historical or generational trauma is you have something that interrupts it, in our case, government policies and boarding schools. And so there's a generation that's sort of missing, generation or generations that are missing those pieces. And so instead what's getting passed on is all that loss of land, culture, the abuse, all of those things. And so even though the boarding schools are gone and the government policies have gotten better, you still have all this negative stuff that's getting passed on. And I don't know if this has ever happened to you, but it happens to me. Usually by well-intentioned people, they'll come and they'll say, Isaiah, those things happened so long ago. Why don't the Indians just get over it? And what I always tell them is, you know, this is why. This historical trauma is why we can't get over it. If you think about how much energy went into trying to remove that cultural DNA from the community, it's going to take at least that much energy, but probably more to fix it all. And so with the loss of that cultural DNA transmission, people lost the understanding of traditional tobacco, how to gather it, where to find it, how to use it, how to prepare it, how to dry it, all of that stuff. And on top of that, there was a law that said that we couldn't practice our religion. And so people would often use commercial tobacco as a sort of second best or backup way. And still to this day, it gets used that way often. And so you have this, I guess, changed functional meaning of commercial tobacco from one that used to be purely recreational now to one that's, I guess, both recreational and ceremonial. And then American Indians have a very complicated relationship with tobacco. We Well, both American Indian and non-American Indian companies, tobacco companies, use American Indian imagery to sell their products. Think about things like Red Man Tobacco, American Spirit, or even like Seneca, which is an Indian-owned company. Seneca cigarettes, they use American Indian imagery to sell their products. And then we also smoke recreationally at rates far higher than any other ethnic group. In this area, it's believed about 40 to 50% of American Indians smoke. And as a result, then, of course, you have the greater burden of disease that comes with smoking. We also have, because of, if a state passes a law that says that the state is smoke-free, that law, because of tribal sovereignty, doesn't apply on reservations. And so it's up to reservations and tribes on their own to decide what to make smoke-free. And some tribes were actually leaders and went smoke-free first before the state did. And others are kind of behind. And so you have some bars and restaurants and casinos that are still smoking. And then, of course, some tribes sell tobacco as a way of making money. So commercial tobacco, Nicotiana tabacum, can grow to be, 6, 7 feet tall, and a leaf is, can be like 2.5 feet long. And it has a white flower with a pink tip. And of course, it's not traditional to this area. It's often used as a substitute, and because the access to traditional tobacco is not always there. I'm used to doing this in front of a live audience, so I often ask questions like any questions that people have. So if you have them, I encourage you to type them in the box. Okay, so when I talked about the burden of disease, 4 of the 5 leading causes of death for American Indians are smoking-related or tobacco-related. You've got heart disease, cancer, accidents are the only one that's not, diabetes, and chronic lower respiratory disease. And other than accidents, these 4 top leading causes of death are kind of true across the board. There's some subtle differences between American Indians and non-Indians, but in general, those are the same. Although we tend to have a higher mortality rate. So a while back, I'm trying to remember now, in 2000, I think 8 and 9, we did a youth tobacco survey in the state of Wisconsin. And what we found was that American Indian youth smoke at 3 to 4 times higher rate than others, and then the adult rate is about 2 to 4 times higher than others. What we also found was that the type of tobacco used in ceremony was important. So if youth were taught ceremonial use using traditional tobacco, they were about 4 times less likely to have ever smoked or to try smoking. And if youth were taught to use commercial tobacco for ceremonial use, they were 4 times more likely to have ever smoked or to have smoked in the last 30 days. So this is really important when you think about, a lot of folks talk about a return to culture and how important it is that we teach our children. Based on this, it's important that we teach our children in the traditional way, not using commercial tobacco. And of course, we have a strong need for increased surveillance and oversampling in the state and national surveys. When we did a study with the youth, we had an N, or about 1,800 students who participated in the survey that were Native. And some of the, I won't say which state they are from, but some of the people contradicted what I said and said, well, we found that the rate was X, which was lower. And I said, well, what's the N of your study? And they looked at it, and their N was 45, which means they were basing their decision on 45 people, and we had 1,800. And those 45 people were collapsed over the course of 3 years to get that number, which meant on average 15 people each year were surveyed. That's not acceptable. Like, we need to sort of demand from our state departments of health that they need to oversample in Indian countries so we have better data to make better decisions and see how things are changing. Anyway, enough of me being on that soapbox about oversampling. So I actually don't remember what year we came out with this. I'm going to have to peek now. I want to say it was like maybe 2013, maybe 2012. 2013. We came up with this book, Walking Toward the Sacred, and if you email me, you can look it up on Amazon and they'll tell you it's $14. It's not ever meant to be sold that way. Anyway, not on Amazon. Somebody apparently got the book and decided to sell it themselves. But if you want a copy, we can send you a copy for free if you email us. If you want more than like one copy, then we'll charge you. But if you email us, we can usually get you a copy for free. And in there, it tells some traditional tobacco stories. It talks a little bit about some of the stuff I've talked about here. And in general, it's just a great resource. I've had a lot of positive feedback about that book. You can also get it for free. I think National Native Network has it for download as a PDF on their website somewhere. Okay. So I wanted to talk about this tribal casino patron survey that we've done. And to my knowledge, this was the first time this is done. I think it's been replicated now in California. So we worked with our local casino in Lac du Flambeau, and I'm very excited to say that we use a community-based participatory research model. And so it was actually the community that sort of came up with this idea, and in partnership with them, we've done this. So it wasn't just us coming in and saying we were going to do this. It was actually at the request of the community that we came in. And our overall N, or the number of people who completed the survey, was 1,116, and the dates of the survey were in 2011. And I'll talk more details about that later. So this is a partnership between Great Lakes Intertribal Council, which includes the Wisconsin Native American Tobacco Network, and then the Great Lakes Intertribal Epidemiology Center. An organization called Health First Wisconsin, of course the Lac du Flambeau Casino, and then we also got permission from the Tribal Council and the Economic Development Board, which is kind of like the Gaming Commission, I guess would be another way to think of them. And so in collaboration together, we came up with the survey questions. We got approval from the Casino Management Tribal Council, like I said. And then for planning, it was a very iterative process. There were lots of meetings that we'd have, and we really listened to what the casino said their concerns were. They wanted to make sure that they didn't want to be pressured into going smoke-free right away, and they didn't want people to feel like that. They were really worried about the different gaming tiers, and so when we did the sampling, we stratified from the gaming tiers. And so gaming tiers are like, at the time there were 6, so you think of them as people who gamble a little bit might be in tier 6, and people who gamble a lot or spend lots of money might be in tier 1. And they kind of divide them up, and I'll talk more about this later. But so when we sampled from a little bit from each of those, let's call them buckets of people, in proportion to how big that bucket was. And it was a random survey, like we sent it out randomly. And the crazy, amazing thing is the casino gave us their patron database and said, here, take this, and you can come up with a sampling method and stuff using that. And to my knowledge, that's like unheard of. I've never heard of any casino being willing to do that. But again, I think that comes back to the working in community and building trust and relationships with them. So it was very collaborative, and we had the support of the casino. The casino agreed to brand it. They branded the survey as though it was one of their regular mailers. They also agreed to give $10 free play to anybody who completed the survey. They paid for the mailer. So there was a lot of, I was surprised. We were ready to pay for the mailing and pay for the printing and all that ourselves. The data collection happened in August, and then we did some basic analysis with 1,116, and we disseminated it back to the casino management and the tribal council, which is what we originally intended to do. And then a lot of people were like, Isaiah, you need to publish this. It's important. Other people need to see it. This hasn't been done before, blah, blah, blah. So we had all these people encouraging us to publish. And that's something that I wasn't very comfortable with. And so again, we collaborated and we got some technical assistance, had some academic partners that helped us with the writing and the drafting and all of that. And we went to the casino and the tribal council, and they approved our publication. They also, or us writing a manuscript, they also approved us using their name. So we can now say it's the Lac du Flambeau Lake of the Torches Casino. And of course, it's lots of conference calls, lots of different people doing lots of different writing and stuff. And the way it was described to me, and the best definition I like of publication is basically you put all your energy into writing this document, and they send it out to these people with lots of letters after the name who fly in like seagulls and poop all over your document. And then you get that back, and you basically have to clean up all the poop and do it again. And you basically do that until the seagulls stop pooping, and then it's done. So that's kind of what happened. And the first time we got rejected, we submitted to like some fancy American Journal of Public Health or something. And then we submitted to American Journal of Preventive Medicine, and they gave us the revised and resubmit, and it was accepted. So once that happened, we were very excited, and we did lots of press releases and all of this kind of stuff. And we collaborated with the casino to do that as well. So I encourage you, this process was difficult for us, or at least for me. It was a good learning experience, but it also was really helpful, I think, and I think it was really important for building capacity within the community and the tribe, and even within myself. So one of the cool things that I learned was something called a theoretical win. And this is something that the casino uses to decide which bucket or which gaming tier people are put in. And this is a calculation, so I thought it was cool because I'm a data nerd. And basically, this is the fancy calculation. It's house advantage times decisions per hour times average bet times time played is your theoretical win. Here's the easier explanation. So that's my grandma. We're going to call it Grandma Brokenleg, and she loves to gamble. So she's in heaven now, so she's probably gambling in heaven at some slot machines. So let's just say she goes to the casino. Well, each casino and each slot machine has a slot hold, or what percentage basically that it has over time will hold of people's money. And this is true for all the slot machines. It's also true for games like blackjack and stuff, but those are harder examples. This is much easier, so I just use the slot machine as the easier example. So, whoops. Okay, so each time Grandma pulls the handle, it costs 50 cents. And so if Grandma spins the handle 200 times, the total amount that she sort of gambled is $100. And so at the end, on average, over time, she will go home with $93, and her theoretical win would be $7, or what they would call a theoretical win. So when we did the sampling process, the people had to have gambled within the last 3 months in the sample that we took, and they had to have a theoretical win of at least $20, which if you gamble $20, you should be able to build that theoretical win. And they could have built that any time over the last 3 months that we counted, or maybe it was 6 months, I don't remember. But the important thing is that we just made sure that people had gambled. Okay. So a unique proprietary combination of the theoretical win plus the number of visits places people in these different gaming tiers. And this is important. The casino wouldn't tell us what the combination was. Like, we probably could have figured it out, but that wasn't what we were there to do. We were there to partner and build, and this isn't really important how they get put in these tiers, just to know that they are in different tiers. And each casino will have different numbers of tiers and different ways they put people in those tiers. And in the lingo of the gaming areas, all those theoretical wins are called a theo. They just refer to it as a theo. So here are the tier breakdowns. The casino had us sample everybody in tier 1, which is the green. Those are the people who spend a lot of money or gamble a lot of money anyway, and they wanted to make sure we sampled everybody in that category. But everybody else was done proportionally, so tier 2, 3, 4, 5, and 6. And you'll notice the biggest grouping is tiers 4 and 5. That's also true in real life. That's where the largest amount of their income comes from, those tiers. So we asked folks, did they smoke commercial tobacco? And had I known these would be the results, I would have probably asked the tribe when we got permission to do it, what percent would you need people to smoke in order to go smoke free? Because I was expecting, and I think everybody else we talked to thought it would be like 70% of the casino patrons smoke or 80% of the casino patrons smoke. It's not true. Only 23%. And we even asked them a different question, which was, do you smoke when you play? Because we thought that some people who don't identify as smokers may smoke only when they gamble. And the results were the same. It was still 23%. So my question is kind of, why are we allowing smoking when over 3/4 of the folks who come to the casino are non-smokers? All right. We also asked them if they thought that breathing secondhand smoke could be harmful. And as you can see, almost everybody thought it was harmful. So even smokers thought it was harmful. And then we asked them if they're bothered by smoke in the casino. And again, almost everybody, well, more than half are bothered by smoke in the casino. This is actually where the rubber hits the road. So we asked them, all things being equal, would you be more or less likely to visit if smoking were prohibited on the gaming floor? And what we found is the answer is yes. So the majority of people would be more or much more likely to visit if casino or if smoking were prohibited on the gaming floor. And then there's this group of the blue that says they don't care, and then the red says they'd be less likely or much less likely. And again, that group is only 17%. So that's even less than the number of people who are smoking. And if you take out the blue, you can see here that it's actually much more dramatic. If you take out the people so they don't care, you can see that, you know, over 75% or more than 75% would prefer to come much more often to the casino when smoke-free. So again, then the question is, why are we doing that? So these results are in the paper that we published. The next slide, or actually, hold on, this next slide is also, I don't know if it looks like this, but you can look and see each gaming tier, over half of them still said that they would come more or much more often if the casino went smoke-free. Even in tier 3, where you see it looks like it's closer, still over half said they would come more or much more often. And we asked them a bunch of other questions in the survey, not just about their smoking, but we asked them which games do they prefer, do they eat at the restaurant. They wanted it to be not look like it was solely about smoking. That way patrons wouldn't be pressuring them to go smoke-free or not go smoke-free or whatever. This next slide that I'm showing you, that one, this one is not in the paper, but what we did is we took and we multiplied the CO by the sort of number of visits. I'm trying to remember how we did this. Anyway, what you see on this slide represents the amount of money the casino gets from the people who said, who said they would do the different things. So 65% of their income comes from the folks who said they would come more or much more often if the casino went smoke-free, and 35% comes from the folks who said they would come less or much less often. And this doesn't include the doesn't care. So it's actually, those percentages are a little off. But it's just so you could compare the two together. That doesn't care kind of throws everything off, but it's still always over half who say they'd come more or much more if the casino went smoke-free. So again, if over half of your income is coming from that group, then wouldn't you want to go smoke-free because they come more or much more often? So that's basically the gist of what we did and how it worked. And I'm available to answer lots of questions if you have any. One of the questions that I always ask people is, what parallels do you see between this work and your community? So how could these results benefit your community? And this is a similar one. How can you incorporate these findings into your community work? And I think that's it. So I'm available to answer questions. Thank you all very much for your time and for listening.
Thank you very much, Isaiah. Let me go ahead and go up to the top here. Let's see here. The window's kind of skinny for me to read, so I'm trying my best. This first question says, I would love to have the Wisconsin study on commercial use and youth rates. Sandra, I don't know if we have that study.
That one we have an aggregate draft we can send or email. Right now we're working on so what we're doing right now is we're redoing that Wisconsin Youth Tobacco Survey again so we can compare. And we've just finished data collection this spring, and we're working on analyzing it and getting it all ready. So if you wait a little bit, you could have a better example, because then we could do the knowledge of before and now. We actually had to add new variables now, because when we did it before, we didn't have things like e-cigarettes or hookah. Hookah existed, but it wasn't a thing, so we didn't include it in our questions, but now we do.
Okay. Do you or will you do youth surveys again to see if the data is getting better?
Yes. We just did it this year.
Did the casino go smoke-free after your study?
This one, I have not yet. They did something that I hoped they wouldn't, which was to upgrade their ventilation system, which doesn't actually prevent cancer, but they did spend millions of dollars on it. However, there's another casino in Wisconsin who did go smoke-free as a result of this, and that's the Day Joke Casino just outside of Madison, Wisconsin. And they're smoke-free right now. I just went there. I had to go to Madison on Monday, and of course, I had to go there and make a small donation. And it's wonderful. I could be there for longer than an hour and not get a headache. And it's important if you visit a smoke-free casino to put a comment card in that says that you enjoy it and you'll come more often, because that helps them, I think. Same thing, likewise, if you go to a casino that's smoky, put a comment in. They listen to those.
Absolutely. I don't see any more questions that have popped up, so I'll wait another second or two and see if anybody else has other questions. Let's see here. Would you be willing to present this information to our casino management? That came from Gina. So maybe if she wants to send you an email or something, you guys can contact each other.
Absolutely. You can email me. Depending on where you are, I can come there if it's nearby. If not, I can do something over the phone or via like this, like a webinar.
Okay. She said White Earth Nation.
Okay. Yeah, email me. We'll talk about it. That's a ways away, but we serve that area, so I can probably come.
Okay. Let me see here. This other person says the survey concentrates on revenues, which is likely the primary concern of casino management. However, the health consequences should be a concern of policymakers. In particular, the giant study on reduction in ambulance calls in Kipling County, Colorado should prompt support. And another person says, have you done any work in Detroit?
Well, we have a new grant called the Bemidji Area Leaders Acting for Change, and it's through the CDC. It's actually a larger grant called Good Health and Wellness in Indian Country. One of the tribes we work with is Detroit, although I think that they haven't selected tobacco as one of their things. It's mostly access to healthy nutrition, but we do work with Detroit. As far as the ambulance study, we did cite it when we went in front of the council and asked them to get permission to do this. I agree with you that health of people is the most important. However, I think casinos being commercial ventures, they may not see it that way. One of the things that we were going to do as follow-up was looking at how much did they spend. They rent the slot machines, so it's more expensive if you smoke in your casino to rent the slot machines, and how often do they have to replace the carpet or the filters in their ventilation system, and how much premium do they get charged for health insurance, and looking at those things and how much would they save. We were going to do that, and then after this got published, I guess we just didn't move forward on it, but that would be a next step to take.
So the person says the presentation was excellent. I would love to have a webinar on the generational trauma that you talked about in the beginning. And that one came from Tammy Meisner.
Okay, I didn't hear the last thing you said.
that came from Tammy Meisner.
Okay.
Yeah, she was just saying that the presentation was excellent and that she would like to have you do a webinar on generational trauma. So maybe, if there's a way for you guys to connect up, that would be cool.
Yeah, just email me. My email's on the screen. You can call me too. I like to chat on the phone.
Absolutely. And then the other person thinks they also enjoyed the portion about generational trauma as well. This next person says, would you make the PowerPoint available? Yes, the PowerPoint and the recording will be available within about 24 hours after we wrap up here. So we'll make sure to put everything up online, up at keepitsacred.org. We'll send out social media blurbs saying that it went up on the website, and we'll have links to the YouTube link and the PowerPoint presentation and everything else. So everything will go up. This was very helpful. Thanks, Isaiah. What might be some of the reasons the casino has not gone smoke-free in spite of their own data showing widespread support among its customers?
So I have two sort of thoughts about that. One is that I think there's an incredible fear that your casino will lose money. And so if you look at, often the casino is like the major moneymaker for a community. And sometimes people have this misconception that casinos are making all the Indians wealthy, and that's not really true. There may be a couple casinos, but they're definitely the exception rather than the rule. And so many times the funds or profits from a casino are used to do things like make sure that the roads are paved and people have running water and really basic stuff. And so there's this incredible fear of loss of revenue. And if you look at when states go smoke-free, generally there's like a little dip at the beginning, which means it goes down, like the revenue goes down, and then it goes up higher than it was before. And that's what they've seen across several states that they've looked at that have gone smoke-free. So I think part of it is just a fear of revenue loss. And then I think the other thing is that when you're working in a population where 40 to 50% of your community are smokers, even though the folks in the casino might not be, that can influence, I think, the tribal council who would make the final say about whether or not they would go smoke-free. I think another thing, so I guess maybe there's three things. Another thing is just change is hard. Change is hard for everybody. And I think that they're afraid. One thing that I didn't do that I wished I had done is we based it on the way someone was, what do you want to say? The likelihood that they were selected to be sampled was sort of equal based on the gaming tier, unless they were in the very top tier. And it was based on just each person had an equal shot. What we should have done or could have done differently would be to base the likelihood of getting called on the number of visits they had. So this is something that I think what I call the nag factor, which is just if I spend a lot of money and I might be in the top tier, but I only visit your casino once a year, if I want it smoke-free, you're only going to hear me complain about it once a year. If I'm a smoker and I come to your casino every day, you're going to hear, and I'm going to have 30 or 31 times, or unless it's February and it's 28, times to complain that your casino is smoke-free and I want it smoking again. And so if the local population smokes at a higher rate, the nag factor is going to be higher for them that they want to keep it smoking. I think that could also be a reason.
This next person says, without getting too techy, can you explain how you figured out the slide with the percentages of those who spend the most in the casinos?
Okay, I don't know if I can go backwards, but I'm not sure which one they're talking about. That's what I'm struggling with here. Are they talking about the one, are you talking about the one, there we go, take just a moment. Are you talking about the one where it says which percentages came from which tier?
Let me see here.
Oops. Go back like maybe one or...
Isaiah and I are both fighting over the mouse right now.
Okay.
Let's see. I think what they're thinking about is maybe the players club tiers, maybe.
So the, oh, there we go. Oops, go back one, go forward one more. There we go. I'm guessing it's this one. So this is just a percentage of, so the green, the 82 people at 7%, those are, of all of the ones we sampled in the first tier, those are the ones who responded. All the rest were in proportion. And so, but these are everybody who responded from each of these tiers. All of them are included in that pie chart. And originally we were thinking that we would have a response rate of about a low one, like let's say 5% or 10%. We had a really high response rate. We were actually aiming for about 400 people to respond, and we ended up getting 1,116. So that was really good. Apparently it's something that people, I think the $10 incentive actually helped a lot. I hope that answered their question.
This next person says, do you know of any studies investigating the effects of casinos installing new ventilation on health effects or secondhand smoke exposure?
I know that I think it's like nickel G's or something is their acronym, and that they found that it doesn't, like the ventilation may make the air smell better, but it's still not good for you and still causes cancer. And they've done some other stuff that has to do with, like, at least anecdotally, where you are at in the way the air is moving also affects you. So there's the Nathan story. He was a casino worker. He never smoked a day in his life, but he was exposed to secondhand smoke when he was right by the air intake, so all the old air was going right by him, and he ended up dying of smoking-related illness recently. But I'm not aware of any specific studies that I could just like cite off the top of my head or anything.
The sixth person says, I think they're just making a statement. Historical trauma is so important to discuss. Unfortunately, so many non-natives are unaware of how real blood memory is. I don't know if you have any comments on that.
No, I'm right there with you. I agree. Historical trauma is very important, and I wish there was some sort of formula to help heal from it. We know, maybe the formula is just increasing knowledge of our culture and our traditions, but we know that, like, you know, if somebody has a death in the family, there's a way to heal from that kind of trauma. I think this is a much more difficult and insidious thing to have to figure out how to heal from.
This next person asks, does this casino employ American Indians? If so, do they have a concern about the health impact on their fellow tribal members?
Yes, this casino employs American Indians and their own community members. We actually did do a employee survey, and I didn't ask for permission to share the results of that survey, so I don't really want to say much other than that. But I mean, you could know that there's several employees, like many of the community members work there.
Okay. And then the next person says to look at the Canadian Truth and Reconciliation Commission, how they are addressing historical trauma in Canada.
Yeah, they've done some amazing work in Canada. They've done a lot of like listening sessions. It's been very good. I wish we had something like that here. And just waiting to see if there's any other questions that come in. We'll stand by for another couple of seconds here, and then we're getting towards the end, so we can start looking at wrapping it up. I don't see any more questions coming in yet. So we'll go ahead and wrap things up here. Thank you very much, Isaiah, and thank you for everybody for attending the National Native Network webinar series presented by Isaiah Brokenleg.
We'll send out a brief SurveyMonkey evaluation by email this week. Please visit our website at www.keepitsacred.org, where you can listen to other technical assistance webinars, as well as many other cancel and commercial tobacco prevention resources for tribes and tribal organizations. You can also like us on Facebook at facebook.com/keepitsacred, or you can also follow us on Twitter at keepitsacred. Again, we're going to go ahead and upload the video and the slides, the handouts, all that stuff up onto the website here within the next 24 hours. They'll probably be up by the end of the day tomorrow. And for anybody that's looking for the archive of the presentation. And again, we'd like to thank Isaiah Brokenleg for joining us.
Thank you very much.
Thank you very much, and have yourselves a wonderful week.